some adverts that you have seen online asking you or luring you to a better paid job in other countries. Why haven't you made the move yet?
So thank you for having me. I'm from the United States, where privatized healthcare has made the country a mess, and made healthcare in the United States a mess. And I've had family and friends who have had their financial lives destroyed by privatized American healthcare. And so when I came to the United Kingdom about 8.5 years ago to study medicine, I decided to stay because I fell in love with the NHS, because back then it was still ranked the #1 healthcare system in the entire world. I was floored that to learn that you guys had the best healthcare system in the world 10 years ago. And to see what this government has done to it is shocking.
Maybe
that's one of the reasons why so many of my colleagues are leaving.
Sorry, that's maybe part of the point, though, and it's something Carol brought up earlier, is that if you're going over to Australia, you're going to Canada, you're going to places where they have a private healthcare, they don't have an NHS. And so of course you're going to get paid more, but you get paid more if you work in the private sector in the UK as well. So isn't this just pointing to the fact that the NHS can't survive in its current state? Do we need to make the NHS private in order to pay doctors more?
Absolutely not. So tell me this. So back in 2008, 2010, when the NHS was ranked the best healthcare system in the entire world, was that unaffordable?
Well,
no,
we didn't have as aging a population, and we didn't have as fat a population.
No, exactly.
No, I don't think that's exactly true.
We have known about because the population has gone up since 2008.
Sorry, Carol, can I answer the question, please?
Well, no, because you're saying again, you're saying something that you said. Saying you don't think the population.
Let Andrew talk, because it's hard to do it.
Carol is entitled to her own opinions, but not her own facts. And the facts are very, very clear. The NHS, and this is from the Health Foundation and from the Financial Times, the NHS has been defunded by £400 billion over the last decade. Okay, that's a fact. It is a fact that NHS doctors and nurses are fleeing the country, going to work abroad, where it's not only about money, where they can obviously get paid double and triple the amount that they're earning here, but it is about paying conditions as well. If you rewind 15 years ago, and if you look at the state of the NHS, we could afford it, and we were affording it. We had the best healthcare system on the planet 15 years ago. And then we had a government that defunded it, that did not care about NHS staff, that didn't plan for it at all. And they allowed the system to collapse in order to drive more people into private healthcare. And that's why the private healthcare sector is booming right now. Look, I just want to see a better healthcare system for our patients and for my colleagues. I am so heartbroken every time one of my colleagues goes to Australia, goes to Ireland, goes to Canada, and they have to do that. I don't blame anybody who does that, because the situation working in the NHS right now, this government has made it impossible.
Andrew, you want to talk? Andrew,
record numbers of staff leaving, record numbers of staff suicide.
You want to talk about facts, okay? Fact: waiting lists have rocketed since your strike started. Rocketed big time. Fact:
Carol,
you say
I think
people
that you need to look at Wendy's waiting lists.
Andrew, you just had a big stretch there. People are entitled to answer your points. You say people are fleeing this country. Yes, they're fleeing this country to private healthcare systems where you have just denigrated healthcare systems and said they're really bad, both for the country and the people in it. So the people you're saying should say they're going to make money. That's what it's all about. They're just going to make money.
I've got some stats to add into this, Carol, for you. We've got 1.6 billion a year it costs because doctors are leaving this country. 1.2 billion it cost last year because of the strikes. So if we add those numbers together, divide it by however many doctors there are in the country, and we just give each doctor in the country that pay rise, because if we had done that at the beginning of the year, the government would have been...
No one should get a 35% pay hike. No.
After what we went through, protecting the great people of this country during the pandemic.
That's your job.
I think that it is
job.
I'm sorry.
Hold on, Carol. Let him
finish. Can I please finish?
Yes.
I think it is shocking that that healthcare workers that were classified as key workers, you clapped for us. We are seeing record numbers of staff suicide. Carol, if you go to one of your colleagues' memorial services, it is heartbreaking.
Yes,
it breaks people. They only have enough time where they can say, you know what, I'm going to give as much as I can to the NHS because I love it, because maybe I was born here, because I want to fight for it. But every one of those people, and I see so many people who have that energy, who have that passion about the NHS, they're forced to leave because they can't do it any longer.
Okay.
Look, it doesn't make sense when we have poor pay, terrible conditions, record staff suicide, record people are leaving.
Andrew, I'm going to pause you here just because I want to take some calls on this.